Okay, let's dive into this. Welcome back, everyone, to another explainer. Today, we're taking a really fascinating look under the hood at what I like to call the operating system of clinical cognition. We're unpacking an incredible course curriculum titled Clinical Cognition from First Principles. I am absolutely thrilled to walk you through this source material, so, let's just get right into it.
So ask yourself, how does clinical reasoning actually move? Think about it. When a doctor gives you a diagnosis, the final conclusion is usually laid right out there for you. It's pretty obvious. But the exact path they took to get there, the mental weighing of different variables, discarding the red herrings, that process usually stays completely invisible. It's literally locked away in the physician's head. Well, our main goal in this explainer today is to force that trace out into the open. We really want to see the exact step-by-step mechanics of how a medical judgment is actually formed.
Here's our roadmap for today's explainer. 1. Making reasoning visible. 2. The core cognitive engine. 3. Safety and systems thinking. 4. Engineering meets clinical care. And 5. Beyond single diagnoses. Basically, we're embarking on this massive micro-to-macro shift, moving all the way from a single doctor's isolated thoughts right up to complex systemic safeguards.
Section 1. Making reasoning visible, or forcing the trace into the open. This material is super unique because it's built on a dual-track axis. It's tailored for both practicing clinicians refining their skills and the techies building medical AI who desperately need to see the underlying architecture of these medical decisions.
Looking at how the course is structured, it builds completely from the ground up. Step 1 is the core loop, which covers the first 9 lessons, focusing on basic observation and biases. Step 2 scales things up to system specialization, encompassing lessons 10 through 13. And finally, Step 3 branches out into electives and mastery. The big takeaway here is that you absolutely don't scale up until your basics are flawless.
A great example of this foundation is Lesson 2, which introduces something called the Socratic loop. Now, the AI constraint set used here actually questions you rather than just handing over the answers. So instead of a program just telling a student, hey, it's asthma, the AI will ask, well, what findings rule out pneumonia? Forcing a genuine attempt before revealing an answer fundamentally changes what a learner actually retains. It builds this absolutely crucial habit of exposing that clinical reasoning trace. It forces the learner to say, okay, here's what I'm thinking, and here is exactly why I'm thinking it before they ever get to see if they're right.
Moving on to Section 2, the core cognitive engine, from findings to judgment. Now, what's really interesting about this slide is how it breaks down the mechanics of individual clinical thought and exactly how a probability-weighted differential is actually built.
So, how exactly does a doctor turn raw findings into a bulletproof judgment? By actively hunting for failure. Imagine a doctor anchoring on a simple cough and totally missing early-stage pneumonia. Lesson 4 rapidly fires off 5 specific failure modes to catch exactly that kind of trap. You've got the moment of commitment, like did they lock in prematurely? The load-bearing finding, was their key symptom based on a mismeasurement? Then there's signal versus noise, distortion at handoff, and finally, the full retrospective audit. This right here is exactly how we aggressively stress test a single clinical decision to catch any biases long before they can cause harm. By the time we hit Lesson 6, things really start to scale up. We have to draw a hard line between single record reasoning and registry-level population reasoning. And the crucial point is this: what makes perfect mathematical sense for a massive population average might be entirely wrong for the specific, unique patient sitting right there in front of the doctor. Recognizing exactly where and why these two disciplines diverge is a totally vital part of clinical cognition.
Section 3, Safety and Systems Thinking, the climax of Lesson 7. This right here is the core climax of our explainer, signaling a massive, major paradigm shift from individual cognition to systemic operation.
Seriously, lean in here for a second, because the real answer to keeping patients safe lies in FMEA. That stands for Failure Mode and Effects Analysis. This is literally an engineering method, the exact same kind used to build nuclear reactors and commercial airplanes, brought directly into the hospital setting to ensure systemic safety. It shifts the entire focus from a single decision to the whole operational system. FMEA asks a really simple but profound question: what can go wrong at this exact step, and how bad would it be? It forces healthcare providers to stop asking, did the doctor make a good decision, and start asking, is our operational system actually designed to catch errors before they ever reach the patient? It's all about designing a system where making a mistake is incredibly hard, but doing the right thing is incredibly easy.
Which brings us to Section 4, Engineering meets Clinical Care, Upgrading the Operating System. Building off that FMEA framework, we we realize pretty quickly that single-agent reasoning, no matter how brilliant the doctor is, simply isn't enough for scale in a modern healthcare environment.
And this brilliantly illustrates why. A single decision happens in one mind, at one specific moment in time. But a clinical process? That's how that decision actually moves and breathes through a massive hospital. We are taking the invisible thoughts of one single doctor and turning them into a highly visible, heavily auditable pathway that can be measured, tweaked, and perfected using those hardcore engineering principles.
Lesson 11 really takes that FMEA safety mindset we just talked about and applies it across the entire organizational workflow. Care is now distributed through multi-agent workflows. We're using highly structured handoffs so nothing vital gets lost at, say, 2 a.m. You have multiple specialists weighing in through distributed differentials, and if something does go wrong, the team uses systems-level root cause analysis. Not to just find a nurse to fire, but to fix the fundamentally broken system that allowed the error to slip through in the first place.
Finally, we arrive at Section 5, Beyond Single Diagnoses, Wisdom and Mastery. This is where we look at how the absolute highest levels of clinical care layer deep personalization right on top of this rock-solid core loop. Lesson 12 outlines the exact process for precision medicine in 4 clear steps. Step 1, check if standard evidence actually applies to your patient. Step 2, resolve any conflicting evidence. Step 3, and this is a big one, weigh the patient's own preferences and values. And Step 4, safely document the deviation. You see, deviating from standard population-level evidence isn't necessarily a mistake. When it's reasoned and documented properly, it's actually the absolute pinnacle of personalized care.
To wrap up the course concepts, Lesson 13 tackles clinical wisdom. As clinicians gain years and years of experience, their reasoning speeds up. It basically becomes compressed intuition. But true mastery, that requires turning this exact same analytical machinery inward on yourself. It's the habit of periodically auditing your own tacit knowledge to make sure your lightning-fast intuition hasn't secretly drifted into lazy bias.
Which leaves us with this final, challenging thought. Can you actually tell real clinical expertise apart from a shortcut that just looks like it? Are you witnessing a master's compressed intuition, or just someone taking a really dangerous gamble? By applying systems thinking to our own learning and forcing our reasoning out into the open, we can build true, undeniable expertise. I highly encourage you all to dive into the full source material to explore these concepts for yourselves. Thanks so much for joining me on this explainer, and remember, keep questioning everything.